In this video we show the double Bankart bridge technique. This is the right shoulder in the lateral decubitus position. We started by performing the anteroinferior portal just above the upper border of the subscapularis, followed by the anterosuperior portal just lateral to the biceps tendon. Good mobilization of the capsular complex, starting with the tissue liberator, followed by the electrocautery device to ensure good mobilization, and then debridement of the tissues with a shaver to ensure the raw bleeding surfaces for healing. First, two anchors at the 5:30 clock position of the glenoid as well as 4 o'clock position are performed using standard knotted anchors. The sutures of the first anchor are not cut and received through the anteroinferior portal, and also the sutures of the second anchor after performing a good capsular shift. All the 4 sutures are left in place and not cut. The technique shows a good restoration of the labral pamper with the 2 inferior anchors. After tightening, all the suture limbs are retrieved once again through the anteroinferior portal. At the 3 o'clock position, penetration of the capsular tissues using a 45 degrees angled tissue penetrating instrument to shuttle a non-absorbable suture such as Prolene or the lasso sutures, which is used once again to shuttle another more strong fiber wire suture. This is used to shuttle all the 4 limbs of the previous 2 anchors from lateral to medial to exit between the glenoid and the capsulolabral tissues. Pre-drilling of the 3rd anchor at the 3 o'clock position of the glenoid. The suture limbs are retrieved once again through the anteroinferior portal and loaded into the eyelet of a knotless suture anchor such as the 3.5 mm push lock. All suture limbs are then tightened separately to ensure a good tension in all of them. Tension is maintained over the 4 suture limbs while advancing the anchor into the bone sufficiently to compress the tissues without preventing the anchor from advancement. Hammering to introduce the push lock anchor till the laser mark, followed by removal of the handle in an anti-clockwise direction. Good restoration of the labral pamper can be ensured here. This is followed by cutting all the suture limbs and finishing the technique that centralizes the humeral head and ensures good restoration of the tissues under adequate pressure. Thank you.